I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
All right, Brad, you may be having leg pain. It may be coming from your back.
Right.
But there's lots of possibilities. But let's go over two main ones that could be causing it.
Sure.
One could be stenosis.
Right.
And the other one could be a herniated disc.
Right. And I think everyone knows about a herniated disc, or have heard of it. Stenosis, you may have heard of it. It's not quite as common, but there are actually two very different reasons why you get pain down the leg.
And you're going to treat them very differently.
Exactly. And they present differently, and
right.
we can tell that kind of pretty easily.
Yeah.
So let's talk about a herniated disc.
All right.
Symptoms of a herniated disc, typically not always, but oftentimes sitting down for any length of time.
It's going to make it worse.
Right. Get that pain down the leg going.
Yep.
Once you stand up.
Yep. We have a demonstration of where the pain often may go.
Oftentimes it'll start here or here, and it goes down, oftentimes down the back of the leg. Sometimes it'll wrap around to the front, but it will go down in a pattern similar to this.
Yep.
Okay, so sitting down prolonged typically makes that worse.
Right.
Also getting up from a seated position, it hurts and everything hurts, and once you get moving.
Yeah, anytime you're bending that back forward, even carrying things or bending forward like this, you're going to have increased pain with sciatica.
Exactly.
So
if you're walking, oftentimes, if it's not serious, it will improve it.
Right. If it's not really, really bad,
right.
Often that's one sign we look for. People say, it actually feels a little better after I walk a little bit.
Right.
Some say it feels better after they walk a little bit, and then it gets worse again as they walk really too far.
Right. Yeah, that's pretty common.
Yeah.
Now, if you have stenosis, that's actually a different problem where it's getting pinched from a different reason.
Right.
And with stenosis, people say standing oftentimes makes it hurt.
Almost consistently makes
right.
it worse. Where sitting almost consistently
yep.
makes it better. So it's the exact opposite.
Exactly. Walking usually makes it worse. Standing makes it worse. Oh, pain, pain, pain. You sit down, relief very quickly.
It's often called shopping cart syndrome because if they get up and you bend forward and hold on to a shopping cart, it actually feels better
right.
when you're walking with stenosis. But if
you
don't,
the pain pattern can be very similar.
Yeah, it can be very similar. So you have one where sitting makes it worse, which is sciatica,
right.
and one where sitting makes it better, that's stenosis.
Right.
Walking makes stenosis worse, makes sciatica better. Got it all?
Yeah.
Okay.
So
what are we going to do?
Yeah. How do you treat it? Okay, if the walking makes it better, the sitting makes it worse, and it's the sciatica,
right.
then we're going to do
press-ups.
Press-ups.
And we just did a video on this, and we've done videos on this, but we can link a few of these. But basically, you're going to be putting your hands beneath your shoulders.
Just wait, Bob. Turn around and do this one.
Turn around which way?
Yeah, stand up, turn around.
Okay. Oh, you want to see the leg pain?
Yeah, go away. Okay. So
see it?
Yep. Can you see this? Okay. So we got the leg pain going down here. You're going to lay down. Let's do some press-ups, Bob. And Bob's going to do 10 of them. And as he's doing them, and I have literally seen this in the clinic oftentimes.
So have I, many times.
The pain starts going away from the leg, from the foot going up towards the butt, and then it ends up here. And if you do 10 press-ups and that happens, boy, you know you're doing the right exercise.
Yep, it's getting better.
Right. Now, in the other case, if walking and standing consistently irritate it and sitting makes the pain go away, you're going to lay on your back like this, and then you're going to do double knees to chest.
You bring up one. You might even stretch one first.
Right.
And you might even stretch the other one first, bringing it forward, and then bring both up.
Right.
And then
you'll do about 10 repetitions of these as well.
Pressure off, pressure on, pressure off.
Sure.
And you can just hold it too.
Yeah.
I mean,
and these should be pain-free. It should feel like a good stretch.
Yeah, again, that's going to feel better. I mean,
sure,
so
exactly.
That's, again, the opposite treatment, that's for stenosis. The other one was for sciatica.
Right. So as far as repetitions, usually 10 to 15, three times a day. You could do more if it's responding well. Exactly. You can do it more, only if it responds well. So what do you say, Bob? Stenosis or herniated disc or sciatica?
I don't know. Which one? What should I say? We covered both. So thanks for watching.